From January 1 to June 20th, 2019, 1,077 individual cases of measles have been confirmed in 28 states. This is the greatest number of cases reported in the U.S. since 1992, and since measles was declared eliminated in 2000, according to the Center of Disease Control and Prevention. Outbreaks such as this happen because children are not being vaccinated properly at a young age. Not vaccinating children is causing diseases that were previously eradicated to be reintroduced into society. This is why public schools should have requirements for children to be fully vaccinated before being able to attend. An unvaccinated child is dangerous to him or herself and those around them. After my research, I am convinced that vaccinations are the best and simplest way to protect children and society from diseases spreading. And hopefully after this speech you will agree. Diseases are being reintroduced into our society. They are harmful and even deathly. Children are the most likely to be affected by these diseases because they do not have a fully developed immune system. Having protocols and laws in place in order to resolve vaccinations before attending public schools is one way to prevent outbreaks. The CDC states that outbreaks occur when the actual number of cases reported in an area exceed the expected number. Vaccinations are the reason that diseases such as the measles or smallpox or polio have been eradicated from our society. Failing to vaccinate your children is putting yourself and others in jeopardy of contracting one of these diseases. No U.S. federal vaccination laws exist, but all 50 states have laws requiring children attending public schools to be vaccinated against diphtheria, tetanus, and pertussis, generally in a DTaP vaccine, polio, an IPV vaccine, measles and rubella, generally an MMR vaccine, and varicella chickenpox. While these state laws are in place, there are medical and religious exemptions that parents can send in to excuse their children from having to have these vaccinations. There are also exemptions in 15 states for personal belief or philosophical exemptions that should be completely eliminated. Vaccinations are extremely important and should be taken seriously. Due to state laws and exemptions to the vaccination requirements, people are able to opt out of vaccinating their children before sending them out into the world. Having federal laws that do not allow for these exemptions and transcend the state laws would help to alleviate the number of parents who are able to use these loopholes in order to not vaccinate their children. This has been a hot topic for years now because of the widespread panic that vaccinations will make your child autistic or give them some other mental or learning disorder. The CDC has done a multitude of research into whether or not there is a link between autism and vaccinations and found that there is no link. The studies have proven that the vaccinations are safe and only affect children in very rare circumstances. Reagan Miller, research director of Future Ed, states, this complacency, together with fears about vaccine safety, has depressed immunization rates in recent decades, thus increasing danger to those in a community who are susceptible to these diseases. The solution is clear. The laws and mandates that are in place should be enforced, and the exemptions to opt out of vaccinations should be abolished. State laws should be more heavily enforced. Federal laws should be written and put into effect in order to ensure that state laws are being enforced. Parents that refuse to vaccinate their children should not be able to enroll them in public schools. This is where the federal laws being in place in order to enforce the state laws will come into play most. If it is found that a child has not been vaccinated, they should be removed from the school immediately until they are vaccinated or the parents prove why they are not being vaccinated for medical reasons only. If the parents cannot provide the necessary medical documentation and will not vaccinate their child, they will be forced to choose another option for education for their child. Homeschooling or private schools are two such options for these parents. Allowing these children to continue in public schools would be putting the other students and their families in danger of contracting these diseases from being in contact with the unvaccinated students. These exemptions for vaccinations should be abolished, especially the philosophical exemptions. If your child has a medical condition that does not allow for them to receive the proper vaccinations required by law, they should be homeschooled or have the documentation stating why, and be closely monitored during their time in public schools so as to make sure that other children are not at risk. Personal and religious beliefs should not be exemptions. There are many religious private schools that also share those beliefs. Public schools do not adhere to religious beliefs. The school systems are also capable of putting more strict policies in place in order to protect their students. By revising its admissions policy and refusing to accept new students whose parents opt them out for personal beliefs, the Children's House illustrates how schools are becoming ground zero for the anti-vaccine dispute. It also serves as an example of how educators, not state legislators or health officials, may be the ones who ultimately resolve the public controversy over immunization requirements, as told by the journalist Jacoba Jurist. After going over the laws and possible consequences of not vaccinating children before they enter public school, I hope you will agree with me why we need to tighten our policies and ensure public health and safety to our society. For decades, all 50 states have required that parents vaccinate their children against various diseases, including polio and measles, as a prerequisite to enrolling them in public schools. We should not be exempt or go against the required laws that have kept our society safe due to rare cases and personal beliefs that are unvalidated. There's a reason that no one has had polio in decades. There's a reason that the measles were deemed eliminated in the year 2000, and that reason is vaccinations.